Hey everybody, this is Dr. Daniel Choi here from North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center.
And I'm Dr. Adam Bellingham from the Grapevine Dentist.
All right, Dr. B, we were just talking about this. We see this happen a lot in dentistry, and honestly, even I as a consumer, if I'm getting any sort of work done, I'm honestly asking, can I trust this person, right? So what we were interested in talking to you guys about is, I've been practicing 10 years since residency. You've been practicing 14 years. And so we've seen a lot of our dental colleagues and, we've been asked, seen tens of thousands of patients over all these years. And a common question is we see some patients that are frustrated sometimes. And also I'm going to also internalize that frustration. I've been frustrated with other services that I've gotten sometimes, right? And it doesn't usually come to it doesn't come to expectations sometimes. So the question comes up, can I trust this person, right? So we want to talk about, can you trust your dentist, right? So we're going to make this maybe a two-part, but a little bit of a series here. So some things that will help you guys see if you can trust your dentist, right? So what we talked about, the first step would be is the diagnosis, right? So the first step, is your problem warranting a solution, right? And is that solution going to be the correct one for you, or is it over exaggerated? Is it under exaggerated? So Dr. B, could you tell the crowd out here how diagnosis comes into part of this whole can I trust my dentist thing?
Yeah, so diagnosis in dentistry, there are definitely some hard and fast rules and objective things, but there is a sliding scale of subjectivity of, how aggressive do you want to be versus how conservative and passive do you want to be. That kind of comes with each individual dentist as long as they're within an acceptable spectrum. But for example, if you're coming into an office and it's your first time in the office and they're doing their exam, they shoot all their X-rays, and then the doctor's gonna take a look at there. And they look in there and they say, okay, you've got X, Y, and Z. Okay, well, in my opinion, I like to show the patient, I like to show them their X-rays and walk them through where I see the decay, how big it is, what's going on in there. I use an intraoral camera. I'll take photos of the teeth where there's potential problem areas. I'm a big proponent of, so that you're on board with this, I'm going to show you everything that I see so that we both see it, we both know that it's there, there's no surprises, and everybody's on board when it's not just this nebulous, well, he told me I need 4 fillings, and, well, where are they? I don't know, and I don't know how big they are. And I prefer everyone to be educated and be on the same page. And so that's kind of one way you can look at it as, okay, well, you just told me I have X number of fillings. Do you mind showing me where they are? And most of us will have no problem with that. We'll be happy to show it to you. If they don't or can't or won't, that's, maybe a little bit of a red flag there.
So could we talk, and I definitely want to have you walk them through, for example, an X-ray, because, you could show me an X-ray if I haven't been to dental school or whatever, and I'll be
it's
I don't know, But then, it's not rocket science, right? Even our assistants, or hygienists, people who are looking at these X-rays, once we teach them what to look for, they're is this an X-ray?
They get a pretty good idea of what's going on in
easily,
there.
Right? So I'm pretty confident that the public can be educated on this. So it's it'll help you and be all right, cool. Again, I use an example is if you're gonna do roofing for me, I'm not gonna be well, the guy says I need to replace your roof. I was man, I just got it replaced 5 years ago, and there's not been any hail damage, here in Texas.
Show me what and why and where.
And then they could show me and be I see this area, see what's going on. I'm all right, but if I could watch some videos, be educated, oh yeah, I saw this before, okay, I trust you, right? So if you could walk us through some of that. But even before that, I want you to, we were discussing this a second ago. You mentioned this earlier, subjectivity.
Yes.
Dentistry is super subjective.
It is.
Good God, this guy can say you need 2 fillings, this guy can say you need 10 fillings. And immediately what human nature is going to be, and I get it, right? I would think the exact same way. I'm going to side with the less invasive. Wait, how could you say that I needed 2 fillings and this guy says 10? You must be a liar. You're a car mechanic. I'm going to report you to the dental board.
Yeah.
And I've seen cases like that, right? So people get pissed off about stuff like that, and I hate to say it, but dentistry, like cavities are super subjective, you know.
They can, yeah.
Fortunately for me being a periodontist, like I just do surgeries. I mean, your wisdom teeth need to come out or they don't need to come out, right?
It's very
you
yes
got
and
gum
no.
disease or you don't got gum disease, right? So it's very yes or no. But could you explain a little bit about what we were just talking about?
Yeah, so when we look at decay on an x-ray, and we'll walk through an x-ray here in a minute, but from a subjective standpoint, you know, everyone, when you come in for your exam, say you went somewhere before me and they took x-rays and told you, you need this. Okay, well, I take my x-rays, and there can be some variances in what angle that x-ray was taken that can make the filling or cavity look slightly bigger or smaller. If you remember, a tooth is a 3D thing, and a picture of it is a 2D thing. So when you smush it all flat into a picture, angle makes a difference, and everyone's trying to shoot the best x-ray they can. So there's some subjectivity in there of like, well, it's pretty close. Do I feel it? Do I not? Where on a little bit different angle, maybe like, oh yeah, we can definitely watch that, or we can definitely feel it. You'll get those kind of variances.
So even how your assistant takes x-rays can matter.
Can make a difference, yeah. And I mean, how you read them that day of just the right angle can tweak that, and that's within the realm of just, you know, kind of it is how it is. The other thing that we take into account is that we never are great about explaining, or we find that we don't always take the time to explain well, is what is your personal decay rate, so to speak? How susceptible you are to decay via your habits, what you eat, and what you do with your teeth.
That's easy to tell if you've been a patient of record.
Yes, but when you're a new patient, that's very different.
Right.
And that's where a lot of subjectivity will lie. If you come in and I look at your x-rays and you have a whole bunch of teeny tiny little cavities starting in between the teeth.
Right.
Okay, well, you could look at it in two ways. You could say, oh, well, these are all pretty teeny tiny. It's the first time I see you. I'll give you the benefit of the doubt. We're going to watch all these.
Right.
You know?
Well, now, why would somebody want to watch it, though?
When we look at an x-ray, again, when we'll go through this, if it's between the teeth, if the decay is just touching, kind of textbook-wise, we say if it's through that enamel layer and touching the inside layer, it'll only get bigger. You want to fill it. Now, how fast it gets bigger very much depends on how much your sugar intake is and how well you brush and floss. Sometimes it can take years for those things to make any change in size on the x-ray. Well then, if you're a patient of record and we've seen that never change size for a long time, well then, okay, we have all that back info. Right. We can say, we can wait a little while. As soon as it changes size, it's growing, we need to fill it. Or the other look on there is like, man, you've got a lot of little spots starting, which means you are potentially prone to decay and we're catching it in the first phase.
Right.
We need to be a little bit more aggressive. Let's fill all those and knock out that load of bacteria that causes that decay and get you back to a good square one.
Right.
Both of those are potentially valid ways of looking at it because we don't have any history on you.
Right.
We've never seen you before. And all we can go by, and we don't mean this mean to patients, but everybody tells us they're great at brushing and flossing and never eat candy and don't drink soda, and we all know that's not the case. Come on, we'll be real.
Right.
So when we're looking at you, we got to make that judgment call of some people go to that more passive arena of let's watch everything for a while and see how you do, unless it's a really big blatant cavity. Right. And some people are like, hey, it looks like you have a pretty high decay rate.
Right.
We need to jump on this. Because if it is a high decay rate and it could grow real fast, well, you don't want it to get real big because the bigger it gets, the more expensive it is to fix, and you could end up in crowns, root canals, blah, blah, blah. Fix it when it's small, it's better for the patient.
So, like, when I was in dental school, what was frustrating for me is that, like, because dentistry is so subjective, I would have some instructors that would, like, you know, we would diagnose one day, and they're like, yeah, you got a few cavities, like, okay, go ahead, set the appointment up. So we set the appointment up, and another day it's a different instructor, right? And they're like, cool, let me look at it real quick. And they're like, well, you know, honestly, we can watch all this. So the patient, like, leaves confused, like, I thought we were doing 5 fillings today. It's like, now I'm hearing I don't need anything. We can watch it, right?
Yeah.
So for me, even as a, like, learning dental student, I haven't done a filling in 13 years, obviously, but it was like, that's the subjectivity we even saw in our dental school, where basically you would think that everyone is supposed to be on the same standardized plateau of like how we diagnose and stuff, right? But so that was a testament, like, of how, and that was what we call occlusal cavities. So cavities in like these pits and fissures on the top of your teeth, right? Where it's a very common area to get cavities, right? Because like you're chewing like a Laffy Taffy and like not brushing that well.
It's stuck in that teeny groove. Toothbrush bristle only gets so far in there.
And one of the things that we do to diagnose is like we go in there, we're feeling with our little explorer, and it sticks there, right?
Yeah, if you get a like soft or a sticky spot,
you get that.
There's decay there.
Right, so there's decay. Now some people would just be like, well, you know, like let's just watch it. We can put some fluoride on there and this and that. And then like the thing is that like, and then we have other people like, no, like we got a problem. Let's nip it in the bud before it becomes bigger. So I see both, like, you know, I could see both like points of view. But like now what I want to talk about, what I was basically getting to is that, so I graduated residency 2011. I came out and then I heard a lot of this story. It was like 2009 financial crisis, right? So I lost my job, didn't have dental insurance for a few years. Now I'm back. And then these like, and I was at a practice because again, I was working at so many different practices, and I was like, okay, let me look at their previous x-rays. I see their previous x-rays from 2-3 years earlier. You couldn't even see a cavity.
Yeah.
And you could see like pre-existing treatment plans that something might have been mentioned, or watches were recommended, and then here they are a few years later. It's like the reason why they're here to see me now is the tooth needs to be taken out, and now we're talking about an implant.
Yeah.
So now the argument was like, is that the case for every single patient? No, another patient could have literally, if like, you know, like use fluoride and like, you know, brush their teeth really well, and like the cavity's bigger, but it was not that much bigger when it was extraction, right? So we see cases like that too. I think one important point that needs to be made is that, the patient needs to understand that there is subjectivity there, but then also that the dentist needs to do a good job of saying, hey, if we are talking about doing a watch and they're not just writing notes that says, okay, we're gonna watch this tooth, you need to stress that patient, hey, like, what do they call that? Informed consent, right? Yeah. So it's like, you have an issue here. I want you to know that basically we could nip this in the bud. You know, you might have insurance, you might not. But then it's going to be a lot cheaper and smaller to take care of this. And, you know, I'm not saying like, and if you lose your job, I don't want to be negative about this, right?
But I know what you mean. You never know what life will throw at you.
Well, I've seen patients that have gotten pregnant, and then you have an infant. Good, you know, we have a 1.5-year-old at the house.
Yeah, I've got kids. I know how that works.
Your life turns upside down for a few years, right? Especially so. And I've seen people like, you know, again, for me, it's like, you know, the wisdom teeth, and like, you know, we can't take it out during that first trimester or whatever, and like all the things that happen, or like now you have a 1-year-old, you don't have time to come in to get your wisdom teeth extracted, right? So, you know, that like basically what can happen. I think what's important too is that the dentist needs to have a conversation. Hey, you choose. Here, we can nip it in the bud. This is my recommendation that we should do that. And if, you know, we could wait another 6 months and reevaluate, but here's some of the repercussions that can happen. Yeah. But please don't fall off the wagon for 3 years, come in and like, okay, now we have a different conversation, which is thousands of dollars. Yeah. Needing a root canal, a crown, you know, forward crown, like all that stuff.
Where our spectrum of subjectivity and then stuff and diagnosing comes from is like, I'm going to back up and go with this thing that we call the restorative cycle of a tooth. This is a dental school term, but what it basically means is, okay, nothing in your mouth lasts forever, like from a filling standpoint. A filling, a crown, root canal, it's all subject to wear and tear because we're chewing every day. Nothing lasts for forever. So what that means is you get some cavity. If it's real small, we fix it with a small filling. And let's just say, in an ideal world, this filling lasts for 10 years. All right, we bought you 10 years, then you get new cavity around it, you break it on a piece of ice, whatever. Now you get a new filling that's a little bit bigger. And if it's ideal every time, every new thing is 10 years until you get to a point where the filling's too big, then it's a crown. Typically, you only get one shot with the crown. Sometimes you get lucky if you get some cavity under it. If it's not too extensive, we can do a new one. Well, if that crown starts going bad, the next step is either root canal if there's enough tooth to work with, or taking the tooth out in the worst case scenario. So then you gotta see me. Yeah, then you gotta see my trouble. So you've started, once you have to restore a tooth, you've started this timer of how much life this tooth has. And our job is to make the call of when to start that timer and then do the best job so that we're delaying as long as possible to that end goal. So for those really passive guys, they're waiting because they don't want to start that clock. And so they're making the judgment call of where do I want to start that clock filling wise? guys that are a little bit more on the aggressive side are like, I know this clock is already kind of beginning. Okay, well, if I do a really good job and keep it really small, I can do much more small fillings starting that clock and try and delay it that way. And then the extremes on each side are bad.
So can I, there's one caveat to that, is you're assuming also that the dentist, because we're saying, can I trust my dentist, right? You're assuming that the dentist even has good intentions.
Yes.
Right?
I have seen, and that's what I was about to get into, is I've seen the outliers that, in my opinion, there's some malignance behind that.
Right.
I had a case of a young girl. She was in her late 20s, and she came in as a new patient in the office and took all her Xrays. Every tooth, in between every tooth is a cavity. And we're talking fairly sizable cavity. Mm-hmm. And she had been going to a dentist every 6 months, mm-hmm. getting her cleanings, getting exams, and they just moved to this area. And so when I look in there, I was like, we have a lot of stuff going on in here. Were you aware of this? She's like, oh yeah, I saw my dentist every 6 months. He told me I had a lot of stuff in between the teeth, but he just didn't want all my teeth to be filled with fillings.
Yeah.
And I couldn't really understand that. I'm like, we have decay in there.
And it was huge.
And it's big now.
Right.
At some point it was small, and at a point where it goes through that outside layer, it can only get bigger without filling it. So if we're looking at that clock that goes from one filling to whatever, these are now so big that, and she's only like 28.
Yeah.
We have jumped the first 6 or 7 steps in this continuum. Half of her teeth, we were going straight to crowns because the decay was so big. And the other ones were huge fillings, which the next step would be crown. Right. Well, if you get 1 to maybe 2 shots with the crown, 20 years before you're either moving to root canal or extraction. So that means in this girl's 40s to 50s, she is going to have some major dental issues. Where if he would have 2 years ago, 3 years ago, done them all as small fillings, 10 years out, another little filling. 10 years out, she could be into her 80s before we're losing teeth. To me, that's not being conservative. That is, you either are one of two things. You are either way too conservative, you are afraid to tell the patient what they need, or, and that's where I'd hate to think someone was doing this, but you're waiting for these to get big enough, become crowns and root canals, because that generates more money for your office. I don't want to say that about the profession, but I don't know how else to look at something like that. You know, how would you feel to be in your late 20s and you've got a mouthful of crowns and weak teeth under there because they're full of holes from giant decay that could have been fixed with little bitty fillings?
That's an upsetting story for me, because if, for example, there was only one type of cancer and it was always detectable by a blood blood draw, and I was going to my physician every year, and they never
I had it and they were afraid to tell you.
Are you kidding me? That's
or
very upsetting.
Well, it's not that bad, let's wait till it gets worse and then we'll start treating it. It's
because what, it's gonna cost more, or you never know their intentions, right? Or was that laziness, or was that just incompetence? You know, I hate to say that, but that same spectrum exists. And I have another horror story for you, is that there was a dentist. I never witnessed him seeing like this, but there was a corporation that I used to work for, and I was a traveling surgeon for, and there was a legend of this guy that practices in one of these cities here, and I'm not going to name his name because it would be a big issue, but supposedly from these stories I've heard from so many sources, so it must be true, but this guy would constantly do crowns and shave teeth down and work on teeth without water. Right? When we do fillings and all that stuff, we're spraying water because it
generates heat.
That
and
burr
too much
gets
heat.
super, super hot, right?
And generating heat will kill the nerve in the tooth.
It'll damage it. So then you'll be sensitive, so then you need a root canal. Because then it's more money.
That's why we're drowning you with water all the time.
Exactly.
We're trying not to kill your tooth.
Right, exactly. So now I've heard so many people say that, but everyone's afraid to say anything. But but that was actually happening. So I totally believe that there's a lot of dentists that have bad intentions.
I think there's probably some out there.
I think there's a lot of great dentists that just are afraid to say anything. There was another quick story. Is There's a guy that early 30s cared a lot. You could just tell he cared a lot about his physical appearance, the way he dresses, everything, style of clothes, and I just think that had there been, I was looking through the records for this patient at this practice, and like now the patient needs to see me for implants. Like, whoa, like, wow, like number one, like look at like the damage that was done in 3 years. These teeth all need to be extracted, but they could have been taken care of with fillings or like large fillings or crowns. But because that conversation was afraid to be had, now this patient was being told that they had to do like several implants. That was a lot more money that they anticipated. And then also you got to understand from the patient's perspective, they're like, whoa, where did this come from?
Yeah.
I've been going to your practice for several years.
They were never made aware of it,
right?
Because someone was either for some reason afraid to tell them, or wants to be likable. I mean, we're in a semi-service medical profession. We want people to like us.
Yeah.
It's human nature.
Yeah.
I mean, he might not care. But yeah, you'll see that sometimes.
Right.
And then the patient's blindsided by that kind of situation.
Yeah. So I could totally understand that type of frustration. And then one other thing that you were saying earlier, you were talking about your timeline, right? So you got years and years and years. And then this is another part that's about the quality of your dentist. Can I trust my dentist? That's assuming that they're doing a good filling or they're doing a good crown.
Yeah.
Because if they're moving, they don't care about the quality of their work, or they're seeing tons of patients, or they're just a person that doesn't give a damn. Again, there's so many factors that come into play of whether you can trust your dentist. Yeah. It's the same thing with roofing. I mean, we're in North Texas, and we got so many people moving here.
Yeah.
The housing market is on fire. You can't find subcontractors. I'm sitting there like, oh man, like when was this house built? I was like, they really care?
Yeah. Did they just throw this baby together because
exactly,
it's a housing boom?
Am I going to expect in 2 years that my roof starts leaking or something starts happening or whatever, right? So there's so many things that can go wrong. I'm sorry. Being a surgeon that's always doing these procedures, my brain is just focused towards like what can go wrong.
Yeah.
Like medical issues or with the dental implant or all these things that's the way that I've been feeling, like bleeding or the patient didn't take their antibiotics afterwards. Like these are things that like I don't want to say like I consider myself to be an optimist, but I just have to think this way of all the things that can go wrong, So yeah, like that timeline that you had was assuming everything went right.
Yeah.
And if everything doesn't go right because there wasn't enough removal of the cavities or the seal wasn't there and it wasn't done properly, then and we'll talk more about that in our future series about can I trust my dentist, then that timeline gets seriously compressed. And then I tell patients, listen, I like have a lot of fun with my patients. I love seeing my patients, but I tell them honestly, is like if you don't want to have to come see me, because that means that then you're gonna have to get an implant or something more involved. So anyways, let's show them, let's try to educate them for the diagnosis aspect of it. What are they really looking for?
Yeah.
Right. All right, so let's use this photo of an X-ray to help us figure out what's going on here.
Yeah, so if you came in and I took an X-ray of you and this is what I see, then we got a couple different things going on in this X-ray, and hopefully it'll show up well for the screen for you. But we'll start with the obvious one. We got this guy up here. So what we're looking for on an X-ray, and this is exactly what it would look like if I was showing to a patient, we got this dark triangle right here that's gone through this outside layer, which is the enamel. And then we get into dentin, which is the inside layer, and we can see here this big gray spot. This is a big cavity. And here's where the nerve sits. This is a tooth that this cavity's getting real close to that nerve. This is one that you'd probably, on a small tooth like this, you'd end up looking at doing probably like a crown, possibly a root canal, because you're gonna remove the whole, basically, back half of this tooth. And we got a little something starting right here. Mm-hmm. Now, let's ignore the back part of this tooth. If this was all completely solid and we saw this right here, this is not through that outside layer. We can still see we've got some enamel intact right here. This is the kind of thing that I would say feel comfortable to watch this. Since we've still got some mineralized layer here, if you keep this clean, you floss it real good, you add some fluoride mouthwash to your routine, we have the come to Jesus meeting about getting your teeth real clean, you can actually shrink these down to where they almost disappear on an X-ray, or they never ever get bigger. This is something that's comfortable to watch. Jump down to, say, this guy here. This is a kind of borderline one, where we are real close, depending on how much you focus in. It might be touching that layer, it might be not. This is where things can get a little bit subjective.
Because you're saying that once you get to that dentin,
once you get to that inside dentin layer,
it just blows up.
It will only get bigger.
Right.
You cannot stop it once it gets here.
Right.
Barring some kind of unusual circumstances.
Right.
This one here, now this is a little bit light, but I can tell you from the size of this is touching that inside layer. I would fill that. And this is kind of where, like, this to me is an ideal place to catch a cavity.
Okay.
It is just big enough to touch that inside layer, so it's only going to get bigger, but we can keep it as small as possible. This is like your ideal catch for a cavity.
So I'm thinking from the patient's perspective, I'm like, what the heck are you even looking at? I see nothing of what you're...
This is where, it can be difficult for someone to find, and that's where, like, our years of training and experience of looking at these hundreds of these day in and day out comes into play. But let me backtrack again to that subjectivity, right?
Right.
We're talking about what is your decay rate, as we called it. If this X-ray is you, and this one is kind of borderline, these I'm going to be okay keeping an eye on. I'm probably going to recommend that we fill this one on you because we've got all these little guys starting, some in between here, and a huge guy right here. This person is either intakes a good amount of sugar or their oral hygiene's not that good. When I'm going to look at you with a lot of different factors, and then I'm going to say, in my opinion, I think we might need to be a little bit more aggressive on you on some of these borderline ones. If you came in with, this was not here, one little guy right here, and this, I'd say, okay, let's fill this one. We'll keep an eye on that one. Your decay rate seems to be much less.
Right.
That's where things, and I would tell you all this in an exam. I'm big on educating people. It makes my job easier to get you to do your treatment and to trust me if I give you all the information.
Right.
And that is also where we come in trying to actively push you to do your treatment. We're looking at it on that big spectrum I was talking about of first filling to end of life of tooth. Our goal, if we're ethical and trying to educate you and do the right thing, is to extend that cycle so you keep your teeth for the rest of your life.
Right.
And sometimes that means, in your best interest, we are going to try and push you to get this done. Because if you keep waiting and keep waiting and keep waiting, it gets bigger and bigger and bigger, then you're like that girl that I talked about. We just jumped 7 steps and we're going straight into a crown. And one, you didn't save any money because a crown is way more expensive. All you did was buy time. You didn't buy money. You now paid me for a crown in the cost that you could have spread out over 20 years of 4 small fillings. And we've now gone to almost the last step of restorative options for that tooth.
Right.
Which means 20 years down the road, you might not have that tooth anymore.
Right.
And that is where, sometimes patients will maybe say like, oh, they're really pushing me to get this work done. Why are they being so pushy? Well, if they've gone through all these other steps to build your trust, this is why we're pushing you. We want you to keep your teeth. Sure, pay us money to do a crown, great, but most of us are trying to do the right thing.
Right.
And look for what's in your best interest.
Right. So if I'm looking from the patient's perspective, basically, like what I'm hearing from you, that's good, is like you're not using a cookie cutter formula for every single patient, right?
Everybody's different.
Right. You're like, all right, so you thought about, all right, is this person doing high sugar? Like, are they drinking a lot of Mountain Dew? Are they not brushing as well? Are they never flossing? And we're trying to help that patient out. Don't tell me you're brushing and flossing if you're not.
Yeah.
I want to figure out what's causing this because
we can help you. We can't help you if you don't give us the info, right?
Would you believe that some people's teeth are weaker than others?
Yeah, there is a genetic component to 100%. Density of enamel and dentin.
Right.
Oh, yeah.
So when I used to hear that early in my career, I was like, yeah, whatever. I didn't know, right? And then I'll tell you through 10 years of experience, I totally believe it. And so why I'm saying that is that we can have a patient that's saying like, dude, I'm doing everything I can to brush and floss, using these mouth rinses. I'm trying to be as religious as possible. yet I just keep having these issues, please help me.
Yeah.
The way that I have to look at that patient is going to be completely different if I saw that same x-ray versus someone that says, honestly, I haven't been a dentist in 6 years.
I hate to floss.
Yeah, I hate to floss.
Pound soda all day long.
I just never took it seriously, and then I saw my mom have to get dentures, and I was like, oh, I don't want to ever let that happen to me. So I found the fear of God, like, help me. So I was like, cool, like, let's nip these in the bud and all that stuff, right?
Yeah.
So that's basically, like, I like the fact that we're going over, like, and again, it's not a cookie cutter solution. We take everything into account. But yeah, so like my main concern also is like, and I'm not even a general dentist. If you want to save time and money and not have to come to the dental chair, I own a few dental offices. I don't like sitting in that dental chair. I really don't.
We don't like being on the other side.
Yeah, it's weird. It's like, give me the nitrous, right? Last time I got a cleaning, I had the nitrous, you know? I'm just trying to make it as a pleasant of an experience as possible, right? So I think, so kind of going back, it's like diagnosing, it's what you can do to really, to give you to sum it all up for you guys, to really help you guys know like if you have a good dentist or not, or who has like good intentions. I'd say a very informed person is good, right? So it's like, ask to see the x-rays, right? Can you show me? And then not like, let's be real about it, you're not going to be like an expert at reading x-rays, but then if you're hearing that you need a root canal or something like that, like, can we see like some of that,
do it, ask for kind of what we did going through that x-ray, okay, you're telling me I need a root canal, walk me through your x-ray, educate me.
Right.
And if they, can educate you on it, and of course you do to an extent have to defer to their expertise, but if they show you, here's this huge dark spot, here's the nerve, like that one big cavity was, you can feel pretty confident that like, yeah, okay, I see there's a giant cavity and it is right on top of the nerve. That makes sense. I probably need a root canal.
Right. So
if they show you something with this teeny, you can't see any of what they're supposedly telling you about, you may want to get a second opinion.
Right.
And it never trust your gut, man. If it feels questionable, get another opinion.
Right.
If you're not going to hurt, like even if it's my patient, you're not going to hurt my feelings.
Yeah. And understand there's subjectivity.
Yeah.
And then also like if you're told that you need a root canal or a crown right off the bat, this or that, like, or they started like drilling into a filling and they said you were never told that like you might potentially need a root canal. It is fair to be a little, how suspicious about it. Like, how the hell this happened? Like, I feel like a lot of times, well, not again 100% of the time, not 100% of the time, we are surprised by the fact that a patient might need a root canal, right? Yeah. But usually you could tell, hey, you might need a root canal.
Yeah, there are times when it does happen. But I mean, like in my practice and when we're doing it, if I say I'm opening up a tooth for a cavity, prepping the cavity, and it just is blowing up. Like you looked at the x-ray and you're like, oh, it doesn't look that bad. And you get in there and it's just like huge, which happens sometimes.
In our defense, it does happen.
It does. Yeah. I mean, sometimes it'll surprise you.
You're right.
And there's just, like I was saying, tooth is 3D, the x-ray is only 2D,
Right.
Things get superimposed.
Right.
But anyways, you start cleaning that out. If it starts looking extensive, I'll stop, dry it off, take a picture of it, and show you, hey, heads up, man, look at this thing. See all that brown, nasty stuff in there? Right. This is getting really big. Here's where it looks like we're heading.
Right.
We're not just going to be like, hey, guess what? You're getting a root canal. And you're like, what? Like, no, I'm a big proponent on everyone being on the same page.
Right.
And I think you're owed that if you're, coming in and you want the best health and you're paying us money to do it.
Right.
So that's another thing, just if they will, communication is a good way to kind of see if they communicate well with you, it's probably legit.
Yeah, and like understand too, don't be afraid, like Dr. B was saying earlier.
Ask questions, man. You are not gonna, I much prefer an educated patient over one.
I love it too. I do.
It makes our life so much easier when you're involved in the process.
Yeah, because they're serious about getting the results. Hey, like, that's what I've noticed too. Yeah. I've seen patients that have sought me out, second opinions, or patients that are just did their research and then they found me, like they know that they have this issue.
Yeah.
I love those patients because they are like the ones that, because again, like with everything we do, like let's, for example, I do a lap surgery, we're treating your gum disease, all these things, like because bacteria is always present in your mouth, you need to understand this is not like, this is like hypertensive, like being hypertensive, high blood pressure, diabetes with your sugar levels or cholesterol levels. Like, this is a situation you're trying to manage.
Yeah.
You're never going to be able to get rid of this bacteria in your mouth. Like,
Yeah.
we can't eradicate it. Like,
Yeah.
So because of that,
Fortunately,
we
it can't be
need,
done.
yeah, right. We need your help, right? So like, the thing is, like, when you're active, like in regards to asking questions, hey, do you mind if I could see these X-rays? And then like being this type of person. And also, even if you're just kind of suspicious and you have your doubts, hey, like I don't know where this came from. I'm from Michigan and I moved down here to DFW and I just never seen, like, I've been regular with my dentist and suddenly I'm being told I need like 5 cavities or like a few crowns. And we'll talk more about whether you really do need that crown or not for the diagnosis aspect of it. But like, I would understand like being in their shoes. Like, that's something you're being told you need something. But yeah, don't be afraid to ask these questions. And again, if you still don't believe it, then go get a second opinion, you know?
Yeah,
So,
I mean, trust your gut, and there's nothing wrong with that. There's nothing wrong with getting more than one opinion.
right. So hopefully some of these diagnoses, like with these X-rays, you know, again, you're looking for those areas of darkness and like those, hopefully like they can show you those on those X-rays. And I'm sure like a dentist will be more on high alert if you're aware that you want to look at your X-rays and all these things. I know back in the day, even when I was in dental school, like, you know, earlier days and like just when we were in our books our first 2 years, like, you could do root canal on me and show me, and you could say like, oh, that was an awesome job, and I wouldn't know if it was.
Yeah, here's,
you know.
okay. And also, you know, now that everything's so digital, you know, we can blow these X-rays up and show them to you on a screen.
Right.
You know, back in the day when it was film, you're holding up this tiny little thing trying to show a patient.
Exactly.
Nobody wants to see that.
Yeah. So I hate the fact that dentistry has gotten like sometimes like this. I'm looking at my YouTube channel comments and there's just so many people who just don't trust their dentist or pissed off about some frustrating things that they're going through. And I'm sitting there like, oh my God, this sucks. Like, how do we educate patients more?
Yeah.
So,
Because, I mean, it's hard. It's a specialized thing, you know, and so much of it is you can't look in your own mouth the same way we can.
Right.
It's, you know, it's not like, I know my arm hurts, I need something done to it,
Right.
and you kind of know what the deal is, you know.
and especially that's that because they don't feel anything's going on.
Yeah.
And unfortunately, it's a lot of times it's pain that gets people to come in.
Once it hurts, it's too late, unfortunately, for that tooth for the most part.
You know it's going to be more expensive at
Yeah.
that point. Okay, guys. Well, hopefully you guys found this information helpful. Again, please make sure that you follow Dr. Bellingham. He's over at
the Grapevine Dentist.
The Grapevine Dentist. That's the YouTube channel.
Yep.
And also your Instagram. Yep. So, again, like, I fully trust him, and we're actually partnered in on that practice because we've been working together for 3 years now, and I trust your ethics and your clinical diagnosis, and I've seen the work that you've done.
Yeah.
So, I mean. And again, I've worked with a lot of dentists over the last few years.
I've seen a lot of questionable work and some questionable stuff from surgeons. Like, hey, if I needed work, I'd let Dr. Choi work on me.
Well, I try my best. I know you try your best. Okay, guys, so hopefully you guys found this information helpful. Please give us a thumbs up and keep an eye out for our future videos.
All right, thanks a lot, guys.